Ceremony was held this morning to launch HIV in primary healthcare manual in the presence of healthcare staff representing healthcare institutions in the Sultanate. The manual, of which its objectives includes providing healthcare to patients living with HIV/AIDS in the institutions of primary healthcare and private sectors, the importance of early detection for HIV/AIDS patients, providing the support, advice and medical care for patients with chronic diseases, as well as guiding them for treatment.
Today we are launching a new project, which is the HIV manual for the care of HIV people living with HIV in the primary healthcare and in the private sector. And the aim is to integrate the care of these patients within the primary healthcare, so people can have an accessible care and treatment nearer to where they live. Nowadays, HIV is a chronic disease, and many of these patients living with HIV are suffering from non-communicable diseases, for example, hypertension, diabetes, morbid obesity, and we would like to integrate their care within their primary care physicians and within the private health sector, so that it will make it much easier for them.
National HIV/AIDS control program from the time the surveillance and supporting or reporting of cases in Oman was initiated. The Minister of Health has taken various measures to face this 20th century pandemic, keeping in consideration the importance of the involvement of all relevant sectors in the fight against HIV/AIDS. The HIV/AIDS control section was established in 1987.
The most important take-home message for your viewers is that if you are diagnosed with HIV, it is not a death sentence. You can live a long, healthy and fruitful life. If you take your medication, you cannot pass the infection on to your partner or to your children, and the life expectancy that you should expect to have will be no different from someone without the infection. So that is the good news. Sadly, there is no easy cure for it, but the treatments available nowadays are fantastic. They have transformed the lives of many hundreds of thousands. I think Oman, as I said before, should be proud of itself in terms of the way it has tackled HIV as a problem. For Oman, as a member of the Middle East and North African states, it is clearly one of the more sensitive issues to deal with culturally. And Oman has managed to do it in a way which is culturally sensitive, but also in a way which is very thoughtful in how it allows a strategy to be applied to its population.
With a proper treatment, people living with HIV can now expect to live long and healthier lives. The launching ceremony followed by a workshop which touched upon HIV care in Oman and the role of the private sector and primary health care in HIV care. Abdallah bin Ahmed al-Rubaiey, Sultanate of Oman Television, Muscat.